Hi everybody, J7409, Jewel here with you. What you're looking at here is the coronavirus cell mutating and growing. It's an ugly looking thing, isn't it? Well, I have all kind of news here for you, and later we're going to have a live show today about protection because a lot of things are going on, people, whether we want to admit it or whether we don't. Just like the weather when I do it. We all know the weather's strange things happen with the weather. Well, I don't think we're being told the entire truth about this coronavirus either. Stick around right here and I'm going to show you why. I would suggest you watch this video in its entirety. Before we go any further, the World Health Organization yesterday finally did do something they should have done. A lot of you already know this, but I'm going to show you just so you know. The committee did agree that the outbreak now meets the criteria for public health emergencies of international concern. So what does that mean? It's a global emergency. Now, a lot of us look at this map from Johns Hopkins. Now, you think, wow, they're going to tell us the truth, right? Well, guess what? You're not going to find out if this virus is around you by looking at this map. The only thing you're going to find out is the confirmed cases. And you may not find all of those, okay? The confirmed cases. You still may not find all of them. Just trust me, and that goes for any of these maps that are counting as this virus grows. Now, why am I saying that? Well, I'll start off with my own state of North Carolina to start with, okay? NC health officials will not disclose possible coronavirus cases until they are confirmed. Now, I was speaking with one of my friends right here I met on YouTube about this. I said, we had a case come in at the airport the other night. Well, I heard that on a local TV station and they got in trouble for it. I have found out since, and last week, the state announced it was investigating a possible coronavirus case in a person who passed through Wuhan City, where the outbreak originated in China. And they had arrived at the Raleigh-Durham International Airport last Thursday. But on Saturday evening, they did announce that the traveler was not carrying this virus. Now, why are they not telling people? The change in policy is aimed at protecting the privacy of people who are being evaluated, the State Division of Public Health said Wednesday, and the state says there have been no confirmed cases of coronavirus in North Carolina so far, and if it changes, it will disclose the number of positive test results with this virus. But this is not only happening in my state, it's also happening in Arkansas. Why officials aren't saying where a suspected case of coronavirus was found in Arkansas. And it's all about privacy, folks. State Department of Health spokesperson said the agency has not revealed the city, county, or region where the patient is being tested in order to comply with patient privacy laws. Other states, including Texas and Oklahoma, have identified cities and counties where suspected cases of this virus have been discovered. I'm not going to go on and on. My point is, folks, unless somebody tests positive, they're not going to tell you. My question to you is, what do you do if these people do test positive and you've already talked to them before you go to the doctor and you come down with these symptoms? Wouldn't it make a lot more sense if they just tell people they're testing people in their areas And then if they do not test positive, hooray, that's wonderful. But if they do test positive, you would know if you started any of the symptoms to go ahead to the doctor. This lady right here is a Chinese bodybuilder. Okay, if you look at the date, this just came out today, okay? She's a Chinese bodybuilder, but she's also a doctor. I'm not going to go into all of this, but just to prove you can't trust or believe what you're seeing on these graphs of how this stuff is spreading, I'm just going to scroll on down, if I can, right quick, and show you what she said. In 171 cases of new pneumonia that were cured, 15,238 suspected cases were found. Now, have you seen that number pop up anywhere? Now, you guys know me. I dig a little more, and then I dig a little more. And the coronavirus infection progression through February 20th. This is from, I'll try to make this bigger, I don't know if I can, but it's from the China National Health Commission daily reports. Can you see it right down here? Well, this was made a few days ago, okay? The blue line represents the reported, not the confirmed. See right here? The reported cases, and this was back on the 27th, was 4,515. And what it looks like to them, the model of progression by 2021 could be over 100. Well, you can see it's 1 million, folks. Make it plain and short and simple. 1 million. By the 21st of February. Now this is from the same people, okay? It's a little bit plainer for you so you can see. And this is before it gets on into February. This is by the 8th of February. It's going to be closing in pretty close to 1 million people. And what this means is the infection growth is following a geometric progression of 53% a day. And the RO equals 2.0 to 2.5. That means 2 people to 2.5 people could get infected, or every infected person infects 2 to 2.5 people. That's what it means. Every infected person infects at least 2 to 2.5 people. Once again, this isn't made in fear. But folks, you really need to pay attention. This is in more places in the U.S. than you think it is. And they're not going to put it out that they're sick till they're so sick they're in the hospital. So you might as well get over it. It's going to be in a lot of places. And they're not going to tell you until this person is really sick in the hospital. I wanted you to know this. I want you to be aware of this. And I will have a live show this evening. I don't know exactly what time yet. I didn't have it yesterday because I saw where a lot of you could not come. But I will put up a notice, and I'll try to make a video to let you know when I'm going to have this. So, with this all said and done, everybody stay safe. Please stay safe. I love you so much. You have yourself a good day, a safe day, and a blessed day. Peace, love, and kindness to each of you. God be with us all.